Good morning. I'm Dr. Chris Kingswood, the TSA President and also one of the founders of the St George's TSC Clinic. As UK government guidelines around COVID-19 begin to ease, I wanted to share with you some of the updates and what they might mean for people who are affected by TSC. For people with TSC, the easing and shielding and easing of social distancing means different things depending on how they're affected. Some people with TSC are extremely vulnerable and have been shielding since the beginning of March. Others are less severely affected and there's a whole spectrum, so that some people only need to do what they would normally do for someone of their age in the and normal health in the general population. As you probably have, you should already have been advised by your doctors which group you're in and how vulnerable you are. But it goes from people who have badly affected by pulmonary LAM, for instance, who are in the extremely vulnerable group, or who have poor kidney function or kidney transplants, who are extremely vulnerable, through to people who are vulnerable but more than the population, but less so. Things that can make it difficult or raise the risk of complication of COVID, you'll find on the TSA website, comprehensive list. But significant learning disability is one issue. Challenging behaviour where it's difficult to cope or comply with therapy is another. But do look at the website for the full list and consult your doctor for an individual viewpoint of where you're affected. The advice in general coming from the government is for the whole population across all the categories. It's not really individualized to particular people. And if you're roughly in one group or another, then you can look at the advice and then it's important to make up your own mind what's best to do in your individual case. As you will have seen in the media, the lockdown restrictions are rapidly being lifted in most places, and people shielding have being advised that they can do more, go out more often, but there are a couple of deadlines. You'll find all the detailed information on the government website and the COVID-19 information part. The links to that are on the TSA website, so do have a look at that and particularly look at the what's changed part of it. For any individual, the decisions about whether to stop or carry on shielding, or whether even to shield but with a slightly less strict regime, will depend on their own personal circumstances as well as the government advice. From July, people shielding can go out more and meet other people with proper social distancing and precautions, hopefully avoiding public transport. Those who are anxious to go back to work are still advised to work from home, and even from the 1st of August, when this relaxes further, if you can work from home, that is safer. If you can't and your workplace is COVID secure, then it's reasonable to go. The particular issues with a lot of people with TS is not so much work, but their relatives working. If they're at home shielding because they have someone who is vulnerable in the family, the same advice applies. In addition, going back to school or going to daycare centres, it's the same advice as if going to work. It's taking the precautions, making sure the place you're going to go is COVID secure, and if possible, not going by public transport. For an individual, they will know how severely they've been affected by TS, and they will be able to get specific advice from their TS clinic or their GP about what this means for them. Some people may be much more nervous than others about taking risks. it's important to realise that all of this advice is really about reducing the risk. It doesn't give any absolute guarantees, and it's certainly not a way of abolishing the risk altogether. So anything you do will carry a small risk. And even if you're perfectly fit and healthy, and therefore not shielding and not taking any more precautions than anyone else, there's still a risk of COVID, so long as COVID remains in the community. So the best thing is to meld the advice, look at what the government's saying, look at the TSA website, and make your own decision about how much risk you need to put up with and how much you're prepared to run over the next few months. There will come a day, sometime in the future, when the risk of COVID is virtually zero because the community prevalence is zero, and because there's an effective vaccination. That day is still some way off. It's going to be sometime next year, we think, at the current rates. And between now and then, there may be spikes of resurgence of COVID, which may increase the risks in your local community. So it's important to keep an eye on what's happening in the news and what's happening around you. When this first started, we were very worried about people taking everolimus or sirolimus because we know that in some people that suppresses the immune system, and that was potentially a possible risk, extra risk from getting more severe COVID complications. Taking those medications doesn't affect your chance of catching COVID. The issue is whether it makes COVID worse if you catch it. We know that people who are heavily immunosuppressed with a combination of drugs, for either because they've had cancer treatment or have kidney transplants, are at great risk. But it now looks as if the TS population in general, and people just taking something like sirolimus or everolimus, but without any other drugs that suppress the immune system, are not at great risk. In fact, they're probably at some increased risk, but nowhere near as much as we feared at the beginning. Therefore, we did stop or advise some people to suspend their treatment at the beginning of the crisis for a number of reasons. But we're now advising them to restart it again, to treat the underlying TS problems that they were using it for. Some people weren't able to stop that treatment at all because they were using it for seizures or pulmonary LAM. Looking worldwide, we don't have exact data on what's happened to people with TS and COVID, but we have a lot of individual case reports and discussions amongst physicians internationally. It doesn't seem that people with TS are that much more or any more vulnerable than the general population, or that taking everolimus or sirolimus for TS seems to make that much difference, which is reassuring. Again, at the beginning of the crisis, there was a huge danger that hospitals would be overwhelmed and any kind of standard care would be compromised, let alone if you had COVID. We've managed to work through that, and that's not going to happen again. So that danger has passed, which is good. But there still is a risk from COVID itself in a small minority of people. So trying to avoid catching it is ideal. If you're more vulnerable, then take more precautions. But that has to be balanced against the ability to get on with ordinary life, be it jobs or education, or not going completely bonkers during lockdown and self-isolation. We know that being out in the open air, a reasonable distance from people, is relatively safe if they're not huge crowds. So that is one escape valve that you can use to make life more tolerable. Another question is whether people will be able to attend their TS clinic in person, as opposed to just by teleconference or video conference. As you know, at the beginning of lockdown in the UK, almost all outpatient visits swapped to telephone consultations and video consultations as a precaution and safety measure, really because we thought the hospitals would be high-risk places to go for patients, also because hospital capacity was markedly reduced due to doctors and nurses being very busy with lots of people ill with COVID. That situation's changed now, and the hospitals are probably as safe as anywhere. They're much fewer in almost every area. There are very few COVID patients still in hospitals because the numbers gone down, and they're usually well separated from other patients who come. In addition, there are lots of precautions within hospitals for people to keep safe distances. That has reduced capacity because it requires more room. People going to hospital will be asked to wear masks in the hospital, as will the staff be wearing masks when they see you and talk to you. But it is possible to go along to a TS clinic. Having said that, a lot of the consultations and advice that needs to be given can be done over the telephone or by video conference, and that's much more convenient for people who found it in any case difficult to travel with distances, and obviously particularly difficult if they're traveling with someone who has challenging behavior. So I don't think we're ever going to go back completely to the model where everyone has to come to clinic in person. I think there's going to be a mixture of, but already in many types of outpatients, the patients have the choice about whether to come in person or whether they want just a telephone consultation. That will very soon be happening in the TS clinics as well. Some people have said to me in clinic that they don't feel ready to leave shielding, and I think that's a very reasonable, legitimate view. If that's different people have different views about risk and different needs as well. Some people are desperate to get back to work because they may lose their job. Others desperate to get out to education or to meet other people. But many are anxious about the risk of catching COVID even now while it's still around. And as I said before, the advice from the government about reducing risk is just that. It reduces the risk. It doesn't abolish it in the current situation. And therefore, there will always be a risk. It's a question of how much risk you're comfortable with taking. We do have still, in beginning of July, a high amount of COVID in the general population. We don't have an effective track and trace system yet. Hopefully by August or September we will. But there's still good reason to be cautious for those who feel anxious. And even for those who are relatively comfortable with going out more, you should still be cautious outside. I've seen a lot of people stopping wearing face masks, for instance, in the supermarket because shielding's been wound down and the 2 meter distance rule has been changed to 1 meter plus. But that's actually the wrong way round. People should still take precautions, and 1 meter plus means 1 meter plus face masks, plus not lingering too long next to any stranger, etc. If you have difficulties with your school or your work because you feel you need to shield, then ask your physician to help, to write letter to your employer or your school to say, this is reasonable in your case. I don't think anyone's going to force you to take risks that you don't want to take. At some point, as I say, the risk will drop close to zero, and then we will be advising people to come out. One slight thing to keep an eye on, though, is that it's natural to be very anxious with TS, more anxious than you would do if any other person would be in that circumstance. And that's a thing to keep an eye on. If you feel your anxiety is not justified, then go with your common sense. But if you feel ignoring our anxiety is going to make life very difficult for you, or you're going to be very unhappy, then pay attention and just be more cautious than everyone else. So thank you very much for listening. Please continue to stay safe. If you have any questions or concerns, please do speak to your TS clinic or your GP. Your individual doctor knows a lot more about your particular circumstances and health and will be able to give you targeted advice. But do remember that the TSA is here to support you, and the TSA support line can take and answer your questions, and is a great resource.